For those that don't know me, I'm Brooke Lovelace. I am the Executive Director of the Iowa Developmental Disabilities Council. We're in our second week of session and it's already been chock full of bills and things, so we have a lot to cover. So with that, I'm going to turn it over to Amy. I think needs to keep her video off just in case, so she's here, but you won't be able to see her. But Amy, take it away.
Yep. Sorry, everybody. I have a little bit of an unstable internet connection. So Emily's going to be running the slides for us today. Thank you, Emily. And thanks to our interpreter, Susan, for being here and helping us out. Let's go ahead and go to the next slide. One of the things we're going to try to do during these capital chats is really hone in on a couple issues each time. And so what we really want people to do is take a look at our bill tracker, which is on the Iowa DD Council site, which is just iowaddcouncil.org, and then click on bill tracker and you'll be able to look at the bills. Prior to this, that's kind of a what you can do ahead of each capital chat that we do every other week. That'll help make sure you know what is there, and we don't have to really go into depth on all of the bills that were introduced, because the first week we had 296 bills in the first 4 days introduced, and 80 plus subcommittees at the following week. And there were a bunch this week that got introduced. So please do check that bill tracker frequently, and particularly right before these capital chats, so you can kind of know what's going on and maybe form your questions since we have shorter time. One of the big things that came in up was the first week was the budget. The governor presents her budget and priorities. And so we are budgeting for the next fiscal year, which is called fiscal year 2027. And you can see there that that starts this July and goes a year. So we know there's not enough money to fund our budget. We have a $1.2 billion shortfall out of a nearly $10 billion budget. That's quite a bit. That's because of tax cuts. However, we're able to fund and spend more because we have a surplus that we've been carrying forward, which means we haven't been spending all of the money we had. So we've been stocking it, saving it for just this purpose. So when I say we, the legislators. So you're going to hear some nervousness between the Democrats who are saying Republicans aren't spending wisely, and by Republicans saying that, no, we have enough money. Things will start to come back around once the tax cuts now are fully in effect and people have more money in their pockets to spend. So that is kind of what you're going to hear. But the reality is we're in some trouble, and legislators are not going to be spending a lot of extra dollars. So the governor proposed just a small increase this year of 2%. You can see the numbers there. It's a $9.7 billion budget. It did include some extra money for Medicaid this year because we didn't have enough money to get through this year. But it also includes, and this is probably the most concerning to all of us, there's no provider increases. There's no money that I've seen in it so far for the home project, which is the changes in the waiver system, which I know they've only said is going to cost $2 or $3 million, but I think that's way low from what I've heard before, unless they're going to do some things that change access, which is concerning too. The biggest issue is $52 million in Medicaid cost containment, and we don't know what that means. It usually means providers have a harder time getting paid, and there's modifiers put on there so they get paid less, or it makes it tougher for people to run through hurdles to get the services they need. So we will find out more about that later when legislators start getting answers to these questions and we see the budget detail from the governor. She also introduced some priorities like property tax relief, cancer prevention, because we have such high cancer rates, and really looking at early intervention, rural health access, which you might have heard about the Rural Health Transformation Grant that is all federal dollars going to states from the One Big Beautiful Bill. that will help improve rural access. Changing how veterans programs work. I know that the veterans groups are not happy about that and were not consulted. So um, it's a little bit of taking from some veterans programs and giving it to others. So I think that's the main problem. And then also, many of you know that we've talked about how important county offices are. Um, like auditor who runs county elections, the elections in the county. The governor wants to make those all appointed positions, treasurer, auditor, and recorder, um, and not elected, but she'll leave it up to the counties decide if they want to do that. But it could mean that you have an elected Republican board of supervisors that decides they would like to change to appointed. And then you might have a Democratic auditor that suddenly finds themselves out because they are no longer an elected position. So I anticipate that's going to be highly controversial there. Um, I'll pause there if anybody has any questions on the budget before I go to bills. I don't know that I have a lot of answers. I'm just going to tell you that. Okay, and do check my report this week and the report that we sent out last week, our newsletter. It's on the website too, but if you didn't get it directly, but we do give a little bit more breakdown, and I will try to break down some more of these things as much as I can in that. Going to the next slide, I'm going to quickly show you a few. Oh, I forgot. This is just a chart that I wanted to show everybody. I show it every year. How much of the budget HHS funding makes up and education. So when you really look at all of that, um, that is just a huge portion of the budget. So whenever there's cuts or wherever there's not enough money, you know that it's going to come from either prisons, HHS, Medicaid, or education, because there's really not much else left in that budget. And then you can also see where the managed care plan encounter rates kind of look, how much of it's hospitals versus prescriptions, dental, nursing facility, and Medicare related patients. Moving to the next one. Yeah, bills of interest. I'm going to go quickly through these because I don't want to concentrate a whole lot on that, but I wanted to show that there's several bills of interest right now that we've been tracking. It's in our bill tracker. Some of them you'll recognize from last year. The accessible prescription label bill was refiled. The accessible absentee ballot marking pilot, which is a Secretary of State program. We have a bill that would double the number of MHI beds and allow Medicaid to pay for that. So that would mean less state money going to the MHIs and more federal going into paying for it. I think the question there is people wonder if we really need to build the highest cost level of service versus the investing in step down programs. There was a lot of talk earlier back in December. There was a subacute subcommittee that looked at the fact that people are getting stuck in MHI beds and released to the community without any sort of step down program that helps them adjust before going right smack back to home. Another bill would allow epinephrine delivery systems to be in schools, not just EpiPens. So it's just an updating of that law that passed a couple of years ago. Two more I'm going to make note of, and I don't have a lot of information because they were just introduced yesterday, were changes to absentee ballots when they have to get in. A whole lot of other things that you have to put on your absentee ballot that people may not have information or access to, really meant to make it harder to vote by mail or early. The final one is it makes absentee ballots provisional, which is very concerning because a provisional ballot is only counted after additional information is gathered on it. So those two bills I don't think are going to move forward given their sponsor, but we have to watch out for that, right? So we're going to watch those. And again, what you can do on this is to make sure that you're following the bill tracker. And if you see things that are concerning, use our either email your legislators directly or use our to do that. That way you don't have to look up email addresses. You just have to put in your address. And you can use that for any issue, not just ones that we have alerts on. Moving to the next bill list, I want to get really into the two areas of focus that we have today are education and employment. And there have been a bunch of education bills that have been introduced in this first 2 weeks. And I'm just going to overview them and turn it over to Carlin, who was able to sit in on a couple of the subcommittees that they were talking. But you can see that there's some concerns. There's some thoughtful things about an entire review of our entire K through 12 education system. Given all of the changes, I think some people on both sides of the aisle are thinking maybe that would be a good idea, depending on what they're going to include. Um, We've seen a new tuition grant program, a new bill on the Reach Iowa program at the University of Iowa. Next, up at there's Educate. They're in community colleges and private schools. The comprehensive post-secondary transition programs is what they're called. And the problem's always been how to fund it. So Representative Ingalls updated that bill, and it includes allowing the tuition grant program that funds other programs, education programs, to help pay for these very expensive programs. There's a lot of standardizing, new clinical experience for special ed teachers. There's a Democratic bill that shifts the responsibility for special ed from the AEAs in public schools to private schools, so they would have to pay for them. And a bill that would, if teachers violate diversity, equity, and inclusion laws, the anti-DEI laws that were passed, they would lose their teaching license. And I just put that in there as a reminder that disability is a form of DEI topic. So I wanted to make sure that I included that as well. But I wanted to turn it over to Carlin, who can talk more about some of the issues around creating a separate school for special education and behavioral health needs, or disciplinary standards for schools. It seems that legislators are focusing a lot on special ed students and moving them out of the classroom, which of course is in violation of the federal laws. So Carlin, take it away.
Thanks, Amy. This is Carlin Crow. I'm the Public Policy Manager with the Iowa DD Council. And if you follow Infonet on Facebook and read our newsletters, you might know that Amy and I are doing our best to bring you news of what's going on in the Capitol almost every day. We're trying to be more frequent in our posts, but sometimes it's hard because there's so much going on. So, and this was one of those weeks. And as she said, there's a lot going on in the area of education, and especially special education. I was in a subcommittee this week that a member of the public called for reform of special education in Iowa because of mostly what was in the particular bill, which was being debated, which was how to discipline students. So it was, there was some very disappointing and disturbing language used about kids in special education in this particular meeting. And so to say the least, it put us all on heightened alert about the discussion going on about special ed. And usually we're looking at the budget and what's getting cut. This goes much deeper into, actually, there was also some calls for looking at federal law and whether that needs to be changed in order to protect other students who are not in special education. So the particular bill I'm talking about was not on this list, but it's close. It's similar to House File 2122. It's Senate File 2044. And if you're a teacher, if you're a parent who has a child in school, you might want to look this up. It did pass out of the subcommittee, but they know that there are problems. It's fixing, they think, a bill that passed last year that is still not working as far as how to discipline disruptive and they're calling it violent and nonviolent disruptions, which has its own problems. But basically, what it would do is give teachers and school boards more power to remove students from classrooms, which is against the IDEA for students on an IEP. So we're again looking at that one very closely, and the other one that we have been working on and following for the last couple of years is how to provide more support for students going through a comprehensive post-secondary transition program, or CTP program. And those are the college level programs for students with disabilities, intellectual and learning disabilities, that would help additional students go if there was some additional financial support. So those are the ones we wanted to highlight today. Again, there's a lot of detail in these bills. If you have more questions, please feel free to email us, or you can ask here also. I don't know, do you want to go on, Amy, or do you want to take questions now?
Sorry, I was on mute. Go ahead and take questions on this now, and then we'll move
Janelle,
on.
Janelle, you have your hand up. Do you want to come off mute and ask a question?
So I don't know what is going on, but I was diagnosed with an intellectual disability like a couple years ago, and I've been disabled since I was in high school, and I was on an IEP, but they put me on the wait list for a waiver for like 7 years or something like that.
You were wondering about the wait list?
Yeah, I'm stuck on the waiting list for 7 years, and I'm a member of the Iowa Youth Council, and I spoke to the Board of Education
Yeah, it's good to hear
back
from you,
that
Janelle.
year.
Yeah, your story is not unusual. A lot of people are on the wait list for a long time, unfortunately. And we might get into that a little bit when we talk about Medicaid. That doesn't look like it's going to change much, but they are. HHS is working on, the Iowa HHS is working on a redesign of the waivers, and you would qualify differently. It doesn't mean you get on it more quickly, but it might mean that you could get services that you need more quickly. So if you want to know where you are on the list, you can call HHS or Medicaid specifically and see where you are on that waiting list. And I can talk to you about that later if you want to call me. If you want to go on, Emily, I'm not sure. Yeah, I'll just hop in here with this one too. So the first one here, House File 2017, is designed as an incentive for employers to hire more people with disabilities, because it offers a tax credit for um, income tax credit for employers and for the disabled person. It did pass out of the subcommittee. There were some concerns about cost, and pretty much everything that we were talking about that sounds good. The bad side of it is they're worried about the cost. The other thing about this particular program is that there was a federal program, it expired, so this would replace it in case the federal program does not get renewed. But also, employers are hesitant to use these kind of programs because there's a lot of paperwork and red tape. So they're going to be looking at that. And again, the comprehensive transition programs also deal with employment. And of course, we're also watching very carefully to see what may be introduced regarding eliminating income and asset limits for Medicaid for people with disabilities who are particularly on MEPD. And that, as you may know, is the Work Without Worry bill that has gained momentum in the last, especially in the last year. We know that there's work being done on it as you know, as we speak, because today was the last day for individual legislators to file bills. Um, I just happen to know that there's a senator working on some language, and also on the House side, they're working it into a bigger bill. And we haven't seen any language yet, but we do know that something's going to come up, and so we're watching very carefully for that, and we'll let you know as soon as we know. In the meantime, we want everybody to contact their legislator about employment barriers and opportunities for people with disabilities. And if you want to click to the next slide, that all ties in with our campaign around Let Us Work. And Let Us Work is a campaign. It's a campaign to help people with disabilities have more opportunities and freedom to work, but it's also a campaign to mobilize all Iowans who have an interest in this to contact their legislator and educate them about why there are barriers for people with disabilities to work and what they can do about it. And we, as you may know, launched this campaign last fall, encouraged everyone to contact their legislator ahead of the legislative session. Now that we're into the legislative session, we've moved to our Capitol Blitz, as we're calling it, to blitz the Capitol with Iowans who can come and talk to their legislators personally about, again, barriers and opportunities for more people with disabilities to work. The Capitol Blitz means we want to have people at the Capitol every day talking to legislators about this. And we have a sign-up sheet that if you are interested in coming, you can sign up yourself or your group. We can help work with you if you need transportation. It's in the works. I'm trying to get some support for that. Not guaranteed, but if you do need help with that, let us know, because we're trying to get as many people there as possible. And the idea is just to come and be visible at the Capitol and talk to legislators about, again, the income and asset limits as barriers and other opportunities. And that could include some of the bills that we mentioned earlier that are incentives for employers to hire more people, or for more people to be able to get in a program where they can work more hours. So I'm going to put in the chat, we have a link to the Capitol Blitz sign up. And if you click on that, it'll give you some more information too about kind of the whole idea behind this. We're really launching it in next week with our legislative reception, kind of kicking off the Capitol Blitz. So February 2nd is really the first day that we want to start getting people there every day. We have big orange stickers for everybody to wear that says "Let Us Work," so everybody will know why you're there, and supported material to help you talk to your legislator also. So again, we're waiting to hear what more we could talk about with bills in that area, but for now we're focusing on those income and asset limits and other opportunities.
Harlan, I just want to commend you and the people that are working on the Let Us Work campaign. I have had legislators not commonly associated with the issues that the DD Council works on ask me what's going on with the Let Us Work campaign. I've had other lobbyists ask me about it. So the word is out and the catchphrase is catching. So I encourage everybody to share this with their networks, the link that she sent. Even if people don't come up, if they're starting to talk about it within their networks and with their legislators in general, I think once you agree that the concept of making it easier for people with disabilities to work, save, get off of other public assistance programs, I think that is a common goal of both Republicans and Democrats. And so this I would just say the work that's already being done is catching. So this really is an area where if we throw all of our efforts at it, I really do see that we're going to make some progress in this area.
Thanks, Amy. Yeah, it's a lot about, changing the perception that people with disabilities do want to work, they can work, and there are barriers that have been put in the way that are causing them not to work. And as you said, there's a perception there that needs to be busted about employment. So that's the focus. And we, if you sign up to come to do the Blitz, we also are going to do a mini training every Friday, right after, if there's Capital Chat, it's right after Capital Chat, to give you some tips and tricks for coming to the Capitol, how to talk to your legislator, what's going on, all that. And so, again, if you sign up, watch for more on that. There's also a separate Facebook page in the works so that everybody that's part of this campaign can talk to each other and talk about what's happening with their contacts. And I mentioned stickers. We got stickers. We were working on t-shirts, but we don't have quite enough money for t-shirts. So stickers are going to have to do for right now. And we'll have, again, supported material to go along with it too. So as soon as our Facebook page is updated, our website is updated, and some other materials are available, we'll send them out.
Well, and Carlin, I would suggest, since you're going with an orange theme, people can wear their "This is my advocacy" shirt with their sticker, and the orange will be visible up there.
Of course.
Questions before we go to kind of our final wrap? Time goes by so fast. We got 3 minutes. I think Carlin is always willing to help answer your questions offline if you want to email her or call her.
Absolutely.
And I didn't put it in the slide. I wish I did. But yeah, you can move on to the next one with what's available on our website as a reminder. But I did put in the chat that right now, since we did talk about waiver reform and waiting lists, HHS is now getting comments, and we've been posting this on social media. It's gone out in our first newsletter that they are soliciting or asking for your comments on the waiver redesign by February 13th. So I would not wait. I would go to that link, read up on what the changes are. This is the one combining all the waivers into a children's waiver, an adult waiver, and I believe an older Iowan waiver. So you're no longer having to apply for multiple or fit a certain disability category. The menu of services is supposed to be the same. There's some concern among providers about rates, that they're talking about maybe reducing rates. So I don't think that's in the documents, but I think people should take a look at them, make their comments, pro and con. So you have till the 13th to do that. Final minute here. I'll just make note of the next slide has our upcoming Capitol chats. We will try to be really focused on them. And you can see our first funnel deadline, which is when a bill it's assigned to a committee. It has to get voted out of that first assigned committee before February 20th. And as fast as January went, February is going to go pretty fast too. So we will get back together on February 6th. In the meantime, I shall have a report out coming up. So check it out. Hopefully you're getting it. If you're not, make sure you go to our website and sign up to get our information. Always feel free to send it out. And also the legislative guide is updated. You probably noted that there were a lot of committee changes and leadership changes, and we have, 6 new legislators. So from special elections last year. So all of that's been updated in the guide. So check it out. And I think we're at our time. Thank you to our interpreter. Thank you to everyone. This is recorded and will be put up on our website probably by Monday. Takes a while to get it processed. Thanks.
Thanks, everybody. Stay warm.
I'll try, Carlin.
Yeah, yeah.
Bye.